Awesome. Well, Julie, thank you so much for taking the time to be here. I've been anxiously awaiting the chance to get to talk to you because I find the work that you do fascinating on so many different levels. So thank you for being here.
Great. Thanks for having me. I've been really looking forward to this.
Yeah, there's almost too many questions that I want to ask and I want to know about in terms of your respective expertise. But I thought we just kind of jumped into this experience that I came across that you had, where and you can clear the details on this, but I think that you're reflecting on an ayahuasca experience or you're about to go on one. And you referred to something called shock traumas
Hmm.
and that you were working through shock traumas or with shock traumas. And I found that really interesting theme. What exactly is that? And maybe you can talk a little bit about that experience because I've known a lot of different people who've gone on ayahuasca retreats or been interested, but never someone who understands this stuff from a clinical perspective that can really shed, academic light on it, so to speak. And so I'd love to hear about that, what you were doing, what that experience was like, and feel free to start anywhere.
Hmm. It's so interesting. I was just actually talking about this in my clinical consultation group with my clinic that I run, Sage Integrative Health, last night. And so I want to preface this with that you can hold this from two different perspectives. In the ayahuasca tradition, so that was when I was down in Peru at the Temple of the Way of Light, they refer to something called a susto. And essentially it's when from their perspective, when the soul leaves the body. So some sort of trauma that occurs where you kind of get separated from your deeper sense of self because that no longer feels safe. And there's, from a more Western clinical perspective, that can happen in a whole variety of different types of traumatic events, such as inescapable attacks or, wartime where you can't get away from the immediate threat. And there's a way in which you have to dissociate from yourself for it to be protective. Um, and I think what can happen within the ayahuasca work is that a lot of times people, so I can answer this question from a whole variety of ways. I could talk about shock trauma more generally, or I could talk about one of the things that I often actually see within psychedelic work sometimes, which is something that isn't often talked about because everything's being so sensationalized in the media right now that they don't really talk about places where things can possibly go wrong. So maybe I'll put the question back to you and ask
Yeah,
which one would be better for me to answer right now.
can we do both?
Totally.
Yeah, I mean, pick one. I would love to hear either of them, and I have a feeling that the conversation will discover itself as we go along. But yeah, I would love to unpack both of those.
Mhm. Yeah, so I can speak maybe to what my personal experience was and what led to what they called the susto, which was about a decade ago or more. I had an ayahuasca experience and they had added a plant to the brew that's a very difficult, complex plant to work with. It's one of the master plants in that tradition. And it's called Toei, or it's also more familiarly called Datura or Brugmansia. And it essentially was a plant that was way beyond my skill set to work with. So I
Like
didn't
in
really
terms of intensity or sensation.
intensity, sensation, meditation practices, or even having the cosmological framework to understand
Wow.
what I was experiencing.
Mhm.
It's one thing to have tried other psychedelics, and another thing when you feel like you're getting a glimpse into the universe and you're like, things are there's a lot more going on than I even
Right.
realized. And I
Yeah.
can't really grok that. Um, and that was a big shock to my system, and it was overwhelming, and it also, the length of it, so it kind of almost felt like an inescapable attack and led to PTSD symptoms afterwards because the length of it
From the treatment.
from the actual experience,
Wow.
because it
Yeah.
also, instead of it being a 4 to 6 hour experience, it became a 36-hour experience, and I was exhausted.
Nightmare.
Yeah.
Nightmare.
Luckily I had support in the moment, but it clearly led to, after that, I started developing PTSD like symptoms and panic attacks and um what's it called?
Was
Yeah.
that was that the fault of the guide? in that situation?
It's complicated because technically I consented, but I didn't realize what I was consenting to because I wasn't familiar enough with the plant. So I think, um, there's a saying within a lot of medicine communities of like, you're given what you can work with. And so in retrospect, I feel like there's so many ways in which I grew and matured and in having to deal with that in the years that followed. And in other ways, I feel like, you know, a lot of the more old school practitioners, like if you look at the original forms of psychedelic assisted therapy in like the 60s and 70s, they were pretty high dose experiences. And it was about breaking your ego structure down so that you could surrender and really pass that point. And I think the current narrative is more of trying to take a trauma informed approach where you don't need to actually blast people into this ego dissolving experience, and that you can actually be a lot more gentle and nurturing for people to kind of work with them up to the level that their systems are ready to work with.
So, and perhaps that's more of like the clinical road, right? Is to box this up into traumatic experiences so that you have something to treat.
You explain that maybe a little bit more in terms of.
So if I think of like electrocoolated acid tests, it's kind of like gonzo out there, like I'm going to take a bunch of acid, I'm going to record my entire experience and document it and present this case to the world of like, hey, this is kind of what we can do with this stuff. This is the journeys that you can go on of self-discovery, of loss of ego, of all these things. But how do you really deliver that to a general public because of how far out there it is?
Mhm.
And now, if I'm understanding this right, I maybe misunderstand, there's more of a turn to maybe decrease the dosage and control the experience a little bit more so that you can apply it to more specific things rather than something that might be a little more existential, like the loss of your own ego, which is a individual experience.
Mhm. Yeah, I think there's a lot more people advocating for that in the clinical environment because you still continue to hear so much about how the ego dissolving transpersonal experience is what you need, or the mystical experience is what's required for there to be healing. And I
Mhm.
think there's a lot more advocating for that. Actually, you don't need to have a heroic dose to be able to work really effectively with the psychedelics to help you heal whatever it may be, whether it's depression or trauma or anxiety, and that there is a time and place for those more mystical experiences, but it's not necessarily what you need to shoot for all the time.
Right. I I mean, I didn't know if I would or would not speak to my experience of ever taking psychedelics, but I do remember that the first time was a very profound appreciation
Hmm.
after the fact for everything that is the way it is,
Hmm.
um, existence, and in some case, like a very personal grounding within that. That I thought it would kind of be goofy, and it turned out to be much more surreal and impactful. And that was, that was when I was 17, and it was not in a clinical setting, and you're walking through the woods with your friends. But even from that experience, it seems like these are very powerful substances, naturally occur in our world and have profound properties on our way of thinking. I'm sure both positive and negative. Um, when you go back to that experience and you talk about the PTSD that formed from it,
Hmm.
how do you like sift through that and get on the other side of like a better understanding of the experience, kind of to where you are now? Like you said, when I look back on that experience, I see it as necessary for this, the journey that you've gone on and where you are today. How did you respond to that, the trauma of the experience that you were trying to rid the trauma from your body, if that makes sense?
Yeah, totally. The thing that's coming to mind is that I grew up very fortunately in a very lovely family dynamic. Both my parents are physicians and they are immigrants from former Yugoslavia. And that also bred, like, I think our culture already breeds a very self-reliant attitude.
Mhm.
And then you also have two physicians who immigrated, and you're raised in that family dynamic, and there's some cultural aspects around maybe not talking to your emotional experience a whole lot. And I was the youngest out of three. And so there's a way in which I was so independent and self-reliant from a very young age, just because that was how I was raised. And I think one of the biggest blessings of what that whole experience taught me was having to really change that mentality from relying on myself to opening myself up to vulnerability and being open to asking others for support and
Yeah.
letting go of any judgments that I might have of, oh, I'm being needy or I'm asking for too much or this isn't appropriate. And just being like, no, I really trust in myself to discern when this is something that I can support versus when this is something that I'm needing assistance to support. And then that's also come into my clinical work quite a bit in helping support my clients and trying to discover that as well. So,
Yeah, that's like I go back and forth with this kind of coddling or hardening of the individual as we grow up or we age, because I think there's some very clear benefits to that self-reliance, like perseverance and having kind of like a can do, can figure it out attitude versus uh, being pampered or always having things be told that they'll be fine. And
mhm,
so there's the iron sharpens the sword kind of thought process has benefits. But I did growing up kind of the same way. Like I've always had that mentality. I tried to emulate my father, who was like a hard worker, a provider. He had those hardened characteristics that growing up I idolized. And it wasn't until much later in my life when I needed like therapy, for example,
mhm,
speaking with a therapist, a very vulnerable thing to do because you let down this wall that you've built your whole life of I'm
yep,
going to handle it myself. And here I am trying to speak with someone and let them know all those things that are inside. It's very hard to communicate those to somebody.
mhm.
Do you feel like with the therapies that you work with, is part of it helping people dissolve that barrier?
Definitely. I definitely feel like one of the biggest things with medicine work is two things. One, dissolving that boundary, ideally in a safe setting with a therapist so that people can become more open to being more vulnerable. And then the other biggest thing, I come from a more somatic therapeutic background. I was trained in somatic experiencing. And I really feel like psychedelics teach people our entire culture from a young age is we're being taught to start ignore our bodies essentially. Like
Mhm.
whether it's as simple as like not paying attention to when you're hungry or if you're hot or you're cold or oh, I'm anxious. Is there something in my environment that I should be paying attention to? You're constantly being told, no, ignore those signals. So you're relearning, I feel like, when with the use of psychedelics in the therapeutic container, to start listening to those messages and trusting them again. And it can take a long time because it's like relearning a new language as an adult,
Right.
which is not the easiest thing to do.
How do you choose from the array of available treatments? If someone comes to you, let's say, with a post-traumatic stress syndrome event, or let's say some trauma in their personal life from childhood, how do you discern between utilizing, for example, ketamine therapies, psychedelic therapies, or other available therapies to help treat that person based
Mhm.
on each one's ability to enact the change that you're looking for?
Yeah. Well, I mean, obviously, it's a little complicated right now in terms of what's legal in the clinical setting. So technically,
Mhm.
only ketamine's legal in the clinical setting. Sage is one of the uh, MDMA assisted psychotherapy for PTSD expanded access sites for MAPS,
Mhm.
and but we only get 5 participants that we get to work with that were approved for the FDA. So that's specific to PTSD. And then there's referrals for people to go abroad if they're wanting to work with psilocybin or ayahuasca. And so I just want to kind of name that there's only so much that I can actually refer people to, but I can speak a little bit to the differences in that, I had a mentor many years ago who described something like MDMA as more ego building, and then the DMT containing molecules like ayahuasca and mushrooms to be more ego dissolving. So when somebody's PTSD symptoms are so active to the point where like you actually need to be resourcing them, not trying to peel back more layers to get to the deeper layers of the root of the trauma quite yet, that something that's going to be more gentle in that MDMA sort of way is going to be useful. And then when people are resourced enough and they're ready to start digging a bit deeper, that's when working with some of the more kind of DMT containing molecules can be useful. And then ketamine's kind of in its whole own category because it's neither phenethylamine or tryptamine, but I think it depends on the type of trauma and what's useful. So if we're just speaking about PTSD right now, at least, ketamine's most researched and well known for treatment-resistant depression and ruminative suicidality. It's been shown to be very effective, but I think there are ways in which it's really useful for PTSD as well. And that's where dosage range really depends, because if somebody has, say, dissociative trauma where they're leaving their bodies, and that can lead to actually, like, even though they seem very calm, it's a high energy state and they're actually quite panicky on the inside. Ketamine's a dissociative psychedelic, so you don't want to give them a high dose dissociative experience, because then you're going to be putting them right back into the experience that scares them. But then or it doesn't feel safe for them. But if you use a lower dose experience, that can actually help people feel quite embodied and help them possibly explore their like movements in their body, maybe do a gentle yoga practice or light massage in ways that otherwise they're often too contracted because they're so hyper vigilant on the day to day to feel like their body can even expand into.
That is fascinating. So if we're going to speak first to the non-legal options, at least domestically, what you're saying about that's interesting about the MDMA and a psychedelic treatment. So in some cases, you would actually take someone who might need to be built up in terms of developing a sense of ego or developing a sense of maybe like worth or existence, and then from there, you're saying that can become like a ready state to then progress into other therapies to allow them to go more inward. And in this case that I'm talking about, they're actually not ready for that at the start because of their current state.
Mm-hmm. Yeah, if you read from some of the more old school psychedelic assisted therapy therapists, I think even the Shulgins probably talk about this. Oftentimes the course of treatment is starting with an MDMA session, a couple of MDMA sessions, seeing how somebody responds, and then as they feel ready for the experience, moving them into like a mushroom experience.
And then helping them to maybe look a little bit more inward. And this process, what does it produce at the end in successful cases?
Mm-hmm. I feel like that's so complicated.
It's okay, we got time.
Yeah, and I just want to step back with the caveat of too, also of like, of course, in all these situations, you have to be assessing for what's like medically appropriate, because MDMA has more contraindications associated with it than say ketamine or some of the other medicines. So that's a big factor as well. And then you were kind of saying what's the hopeful outcome, right?
Right.
And oh man, this is where it gets so complex, because I'll be really transparent in that like 98% of my work in working with clients when I'm doing ketamine assisted therapy with them, that's what a lot of my clinical practice is right now, is psychoeducation around what's a realistic outcome
for them to hope for personally. Gotcha.
Yeah, and so you hear so much about how psychedelics are like 10 years of therapy in just
right,
1 6 to 7 hour session. And there is an element of truth to that, and that because it can kind of break down some of those barriers, those walls. There's particular insights in self-reflectiveness and awareness that can come to the surface that otherwise would take many years of building a therapeutic relationship before somebody would feel, you know, safe in their psyche for that unconscious material to start to arise. But the place where I don't feel like it's any different, and it's really important for people to um, just be educated about, is that what you do with that moving forward can take just as much time. You know, it's like you're
Mhm.
given the opportunity to have the awareness, but then integrating that into your life and continuing to work with that material with the therapist or a spiritual counselor or otherwise still takes a lot of time. You know, like if you've had a particular way of living your life for 30 years, 40 years, you can, you know, you might be able to chisel a big chunk out of it, but repatterning that isn't going to just happen in a 6-hour session. So you still
Right.
have to continue to work with it. And then the way I like to explain it to folks also is that, like, you know, we're all kind of dealt a hand of cards of like particular patterns for ourselves that we have to work on. And so I wouldn't say it's that the psychedelics get rid of that particular pattern for you. It's just that it helps you track it and be more aware of it, because under any life circumstances or stressors or whatever it may be, those patterns will re-arise.
Mhm.
But psychedelics can help you be more sensitive to them, more gentle with yourself, more aware of what's the support you need to put into place, or what you need to do to just be tending to it in day to day, whether that be, you know, exercise or meditation or yoga practices. And so I think the psychedelics help you get the leverage to really be putting those lifestyle changes in place, but you still need to be responsible to those changes for it to actually stay persistent for any real transformation to happen over time.
And so with these patients that you're working with, do you have like an outpatient structure that you work with them to kind of say, hey, we discovered these tools in your tool belt. Awesome. Let's teach you how to use those.
Yeah, so we typically either require people to be in ongoing therapy with somebody at Sage.
Mm.
So they do typically a minimum of a series of 3 ketamine sessions with some prep and integration sessions in between each of the ketamine sessions. And then they either continue and do therapy with somebody at Sage who can help them with that. And then we also at Sage have some other holistic providers. So if somebody's needing like a dietitian, nutritional support, or want to work with an acupuncturist or massage therapist, that's available too. Or if they don't, if they already say have an established relationship with the therapist, then we have them continue that care with their therapist, but then we have them touch back into Sage every like 4 to 6 weeks if they're going to be continuing treatment, just so that we can be continuing to just evaluate the process and seeing, you know, how committed they're staying to it. If are there things that need to be adjusted?
You know, it's interesting. One, I appreciate the transparency about the outcomes because when I think about psychedelics or I guess any kind of currently alternative medicine to traditional pharmaceuticals, I can only think of my experiences, which in some cases have been truly profound,
Mhm.
life change, like almost universal changing experiences. Uh, those are not happening from the prescription drug market. So here people are having uh, apparently really impactful experiences, really meaningful experiences that are much different than their current worldly experience day to day. Yet even that really isn't. It doesn't seal the fate of the transformation. You still have to do work on the outside of it. You still have to work alongside a therapist to put these things into play. Yet prescriptions drugs are just being written for people endlessly on like a, okay, good luck, Julie. Oh, it's not working. Or your statins aren't, helping your cholesterol. Let me just up your dose. Let me just up your dose. Let me just make the dose higher, dose higher. Like that's a problem, right? That's a massive issue. How does something like your practice at Stage stand out against this industry to begin to make change there?
Mhm.
Because that's a issue that we face for sure.
Totally. I like, kind of using myself as an example again, after I'd had that experience many years ago, I started developing what they call irritable bowel syndrome, maybe even before that, but it definitely worsened after that experience. And I can't tell you the number of gastroenterologists that I went to and endoscopies and various things that I had done. And not a single doctor did like a food journal with me
Yeah.
to see if like there was like some obvious irritants to my system. It took me like 7 years of trial and error on my own to
Right.
kind of figure out like, oh, these are the main culprits, and if I stay away from these things, then like at least it's tolerable. um
That's devastating.
Totally is. And then you're kind of, and it's hard because the patient ends up feeling like, getting labeled as somaticizing, and it's just
Mhm.
psychosomatic. Where like, yes, psychosomatic might be true, and there's an element of that, but there's a way of which within the medical system you get written off as being crazy, instead of
Right.
realizing like, oh, if you're somaticizing, there's probably some sort of trauma response, and there might be some additional medical stuff that's going on too.
Right.
So
And how dare you distrust the professional kind of
exactly.
narrative? Like I feel like, and I won't share her experience, but similar. My fiance Lauren had an experience where she basically had to solve something for herself over a 2.5 year period, seeing multiple physicians, multiple specialists, where as the patient, as the person going to try to figure out whatever it is that's wrong with you, whether you're suffering from a digestive issue, a skin irritation, sleep issue, when it's not being resolved, when you go to the professional for it, that's really frustrating. And the frustration can create more agony around the issue in the first place. So unless you're really like hard-headed and dedicated to solving the issue, you're kind of at the mercy of one, yeah, being labeled crazy for even repeatedly saying that the things aren't working.
Hmm.
Um, and then you're just up against an industry that you don't understand. So do you see a way beyond that, like with the current way that medicine functions within our society, if we stick to kind of Western society, do you see a pathway out of this?
Yeah, it's interesting. I would just kind of want to highlight your point of like how hard it is when you are suffering to that level to be constantly trying to advocate for yourself, because you're already suffering. The doctors are telling you everything's fine, and then you need to try to find new doctors, new appointments, and that can be, unless you have the appropriate support structure, say you don't have a super solid fiance or family structure to support you behind that, like it can feel impossible, and then you just get completely debilitated. In terms of our system and the way around that, it's complicated because unfortunately it's a place of privilege to be able to look into more alternative treatments right now, even within psychedelic assisted therapy. Like most of the fees are out of pocket, and then if you're wanting to get additional support from a more holistic practitioner, whether or not it's say a naturopathic doctor or a functional medicine doctor, or I've found Ayurveda to be really helpful for me, so an Ayurvedic practitioner, like you have to be able to afford to pay out of pocket for that. So
Right.
I do feel that there is a movement within the Western scope of more integrative medicine and more insurance policies trying to like allocate a certain amount of money per year to alternative modalities, but really integrating that into our system at this point is not there quite yet. And unfortunately, doing enough of the research, like doing FDA trials to um, provide clinical success for evidence-based medicine practices so that insurance will reimburse for it, is like millions of dollars. Like we're
Yeah.
seeing with the MDMA approval process, like MAPS just raised, I think, $40 million or something like that, just to get them to finish through phase 3 of the FDA process. So I want to have a more positive outlook on it.
But you're a realist.
I'm a little bit of a realist, and I do think that there's a way. There are more low-fee nonprofit clinics around and possibilities out there. So I do have hopes with time.
I mean, it's got to be hard when this is just an opinion, and of course it's going to come off as like, of course you think that, but like it feels like pharmaceutical industries and the healthcare industries and the insurance industries are in bed with each other, and
Yeah.
it's just like I don't feel like a conspiracy theorist saying that, because it's like in your face when you go, like, okay, I pay, $400 a month every month to healthcare
Hmm.
every month, and I go to the dentist and they come in, they hook me up to all this crazy equipment that I've never seen before, and blah 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 blah, run through the whole thing, and they're shouting numbers and they're using words you don't understand. Then you get to the end of it and they're like, hey, based on what we've seen, we really recommend you do this, $1,500 treatment. By the way, it's not covered by your insurance.
Hmm.
And then they want to prescribe me some medicine that I don't want to take. That's personally not a big fan of prescription medication. I never have been. And I was sitting there like, this is just fucked. Like,
Hmm.
I'm the person who's coming for the service, who is in a world I don't understand now. I don't understand dentistry, or maybe you don't understand the mental struggles that you're having, or the psychological issues that you're up against. And so you go to where you hope there are answers, and then there's none. And then on top of that, it's like more money.
Yeah.
But that's like a very deep embedded relationship, and it almost seems like uh processes like what you have at Sage, that are seemingly life changing for the people that are doing them, and going through the process. It's as if they're up waiting for it to be proven successful a million different times to then swoop in and bring it to the front of market. Like, is that kind of what's going on at all? Do you feel like you're up against like regulation and regulation and regulation, but it's really just piling up until the success is so overwhelming that it has to be taken seriously?
Yeah. Well, I mean, I think I don't know if this is totally going to be answering your question, but I do think that the psychedelic space is up against what happened within the cannabis space as well. Just like, here's an opportunity to break outside of this more capitalistic structure of the various relationships between the medical and pharmaceutical industry, and but then people seeing opportunities to profit significantly over these breakthrough treatments. And so you're starting to see a lot of venture capital money come into the space, and there's that fear of how can we you know minimize the amount of workforce necessary to maximize treatment outcomes, when I feel like so much of what psychedelic assisted therapy is about having a deeply relational experience with the therapist, so that there can be repair in what it's like to be witnessed with somebody by somebody through your suffering in a time of being vulnerable in a way that's safe. And unfortunately, like, you can't like break that down to an algorithm and just give somebody,
Right.
there's plenty of organizations out there that are doing mail order ketamine treatment right now. And it's, in my opinion, a little bit terrifying to think about people just sending people home with ketamine and looking at it just from a basic biochemical approach, pharmacological approach of it as an antidepressant, instead of seeing how important, like, somebody really being there to hold space for the individual and talk about what the experience was and the impact that has in their life and how that might lead to further change. Um, you know, Separating those things out is unfortunate, because it really is the combination of both the biochemical and the therapeutic side of things.
Yeah, I've seen I don't know if it's because our email chain or whatever, and all of a sudden now I'm being targeted for these type of things. But I was thinking about that, and I'm like, at home self-administered ketamine treatment if I take the stigma of the word ketamine off of it and just think about that, it just doesn't seem like it's like you're missing the mark. It's not about taking the drug, it's about the outcome of the process of integrating the drug with the therapies
Mhm.
to help someone heal through what they're dealing with,
Yeah.
which is that's a very involved experience from all parties, from the therapist, the drug, and the person.
Mhm.
But the marketing blitz of like do it at home by yourself, how 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 do you do that and not either convince yourself it was successful when it wasn't, or then develop, I mean, is there even risk of, for example, dependency in that case? And is the risk for dependency higher in a at-home administered version than to a therapeutic version of it?
Mhm. Yeah, so I think a couple of points there. One is that, you know, for clients at Sage, for instance, it is expensive to do the in-person treatments. So after somebody's done a certain number of in-person treatments, what we offer, and if it feels appropriate for them, if they have enough stable of enough home environment, somebody available, they feel like they can hold the container, we might let people do at home sessions. But the way we set that up is that then instead of the therapist being there with you for the full 3 hours of treatment, you plan to do an integration session, like either at later in the day, that same day, or the next day, for you to get to really talk about the experience, so that that can help save some money for people while still kind of continuing to hold that strong therapeutic container. And we send people home with a sheet for how to, with the instructions for how to set up a safe container ritual, a little bit of a ritual container for themselves at
Mhm.
home. There was another part to your question, and I'm blanking on what it was right now.
Had to do maybe with the risks associated with at-home dependency
Oh,
and
yeah. So, generally what the research has shown is that when ketamine's being done in a therapeutic context, the risk for dependency, like with street use, is pretty insignificant. I don't know if there's any current research about the at home administration compared to when people are doing it in office, but I would guess that there probably is increased likelihood for dependency. I think route of administration makes a huge difference too. Like, most commonly, the route of administration for home is sublingual, and that requires people holding the ketamine in their mouth for 15 minutes without swallowing their saliva, and it tastes pretty awful.
that's the clinical recommendation for at okay.
Yeah, that's the route
Versus
of
people are probably
administration.
just crushing it up or like
Yeah,
eating it,
versus
right?
getting nasal spray or powder and snorting it. Like, there's not a whole lot of barrier to that. It's not a whole process.
That also just conceptually to me, the idea of someone doing a line of ketamine for their therapy session seems off.
Totally. You can get it as a nasal spray in saline solution, which is often used in like chronic pain and
Yeah,
stuff.
that's more
But
respectful.
yeah, it's a little more respectful. But even with that, the barrier isn't there as much. So I do get a little bit more concerned around clients having nasal spray for at home use, at least. So
Is with ketamine is it just feels like um practices like Sage, like yourself, you're up against an interesting challenge in that you're truly invested in the well-being of the person coming to you, and you use ketamine in the process because it's the best available tool to help them get to where they want to go.
mhm.
But your concern lies with the person, like it's truly to get them healed. And when I hear people talk about ketamine, or when I hear people talk about ketamine therapy, it doesn't really feel like it's originating from that space. It feels like it's talked about like a drug.
Mhm.
And now with these at home self administered, I can only imagine on the other side of that coin, right? It's some investors, or people with some money got an idea, they found a way to market it, and they want to get, when you're trying to get a good return, you want to get it to as many people's hands as possible. But it seems like that is the biggest risk with the like respect of the practice that could diminish how people perceive it. So if too many people get their hands on this and administer it poorly, for example, or carelessly, and develop some sort of dependency or bad relationship with it, then in essence tarnishes all the work that you're doing.
Mhm.
So is that something that you at Sage and your team and other physicians talk about, or of as how to like hold the integrity of what you're doing despite how it may be perceived or distributed throughout society?
Yeah, we definitely let clients know up front what our treatment protocol is like and what our philosophy is. So there's definitely a time and space where I think it can be useful to go through like kind of like the standard course of treatment in the kind of more straight biomedical framework is usually doing a series of IV infusions of 6 over like a 2 to 3 week period of time. So people are doing 2 to 3 sessions, and it's usually over an hour, and it's usually a low dose, so people are getting altered but not super altered. And typically there isn't like a therapist in the room. People are going to like a pre-op room, or yeah, it's pretty clinical feeling. And when somebody's having really highly ruminative suicidality and they're needing a really quick course of treatment to help decrease the suicidal thoughts, that might be totally appropriate. Now, ideally, they have a therapist available, but you can't always have a therapist available on a 2 to 3 times a week basis, like people's
Right.
space in their schedule. But I think the thing that sets Sage out differently is that, you know, if somebody's needing that higher level of care, we'll refer them out. And otherwise, we're really moving at the pace of what the client is needing. So we don't have, it's, people, we can't tell people right off the bat, you're going to do this many sessions over this period of time, because really what we want to do is we want to do a session, have a follow-up therapy session or two, see what they're at, seeing what sort of support they need, and then moving into the next session after that. So it can really vary from person to person, because again, they might need some extra therapy sessions in between, or be building more of the rapport with the therapist so that they feel safe and ready to go to a higher dosage in the next round. And that can really vary quite a bit from between patients.
Can you speak a little bit to the experience of what these doses are like for an individual? I guess I should put some parameters on it. Uh, let's just say for someone who is coming in with feelings of depression, for example, what's kind of the personal experience on the dosage
Mhm.
from maybe that more entry level space to some of the higher, more focused and intense doses for them?
Yeah. So, you know, some of the literature says to get a stronger antidepressant effect, um, it's best to have high dose sessions. So it's kind of that combination of therapy and getting people into that more transpersonal dosage range. Now, I've found that for some people, they don't actually need to get into that like fully dissociative psychedelic space for them to have a strong antidepressant effect. But so how we handle it is, it's always a titration process. So you start with a low dose and you make your way up. And we always start with sublingual ketamine, because the onset is a lot slower versus when you're doing intermuscular injections. So we do intermuscular injections and we do sublingual. IV requires a bit more just equipment and monitoring,
Right.
and so it's more to do in an outpatient setting. So we're always starting with low dose sublingual, which is about 50 to 100 milligrams. And then each session, depending on how the person tolerates it, you go up. So we call that low dose range the psycholytic dose range. So that's more going to be psycholytic, is meaning like enhancing the therapy. So it helps break down some of the the walls that might be up so that the person can feel more open to speaking to the psychotherapeutic process that they're already in. And then as you start to increase the dosage, you start to get into more of like a dreamy space around 150, 200 milligrams. And then getting to 200 milligrams, 300 milligrams is where more that dissociative psychedelic dose range happens. And then again, then there's kind of a transition point if it feels appropriate for the person. Some people come in requesting it, but it's usually not until after a couple of oral ketamine experiences that will offer the IM injections, just because since the onset is so rapid, the intensity level is a lot higher and the level of disorientation can be a lot higher. So we want to see how people are responding before doing an IM injection.
And are there, with those incrementally more intense doses, what are the risk factors associated with that for the person?
Mhm.
Obviously, I'm sure, obviously you monitor vitals and heart rate, blood pressure, things like that. But as far as psychological risk, are there intense freakouts? Or kind of what's like the spectrum of things that can happen if something were to go wrong?
Mhm. Yeah. Well, first, I just want to speak to also that, we move up as feels appropriate for the person. Some people, a lot of times, again, because of what's spoken about in the media, they're like, okay, I want to get to that high dose IM experience. And then say we make our way up to that high dose IM experience, and people are like, all right, can we actually
Yeah. Where's the off button?
yeah,
Yeah.
most people end up being like, I think I was actually good at the like moderate dose range. I don't actually need to go for that. I'm glad I did it, but
Yeah.
that's not where we need to
Now I
be
know.
ongoingly. Um, and then in terms of worst case scenario, with ketamine is used. So, one of the reasons why it hit so much popularity is because it can be used so safely in the anesthesia setting. So, like, I think it was during the Vietnam War, soldiers were sent out into the field with ketamine instead of opiates because you don't need to track. It doesn't cause respiratory depression. So if somebody
Wow.
got injured in the field, you could give them ketamine while you were transporting them to the hospital.
They'd be safe.
They'd be safe versus if you give them a shot of morphine, then you're transporting them, they're injured, and you have to make sure that their respiratory rate isn't going down.
Right.
And then it's used for kids for conscious sedation because they have such little airways in the emergency room all the time, so that you can reset a broken bone or whatever it may be. So there have been a couple of incidences. Several years ago there was a report that came out about I think a young man that was super agitated, so the paramedics actually used ketamine to sedate him, and they used a really high dose, like an anesthetic dose, like 500 milligrams IM or something, and the kid ended up going into cardiac arrest. So in the high dosage range, you do have to be concerned about really highly elevated blood pressure. If people have a history of cardiovascular disease, high blood pressure, you have to be concerned about that and monitoring that. Now, the psychedelic dose range is about a fifth to a tenth of what the anesthetic dose range is. So
Wow.
even at the highest psychedelic dosages that you use, you're still needing to monitor blood pressure, make sure that somebody doesn't have significant history of cardiovascular disease, but it's not like tremendously significant concern. And then in terms of more of like psychological side effects, you have to be mindful if people have a significant psychiatric history of schizophrenia or bipolar disorder. It may not be appropriate because that state of, altered consciousness can lead to a more disorganized or fragmented ego structure afterwards. It's usually not as appropriate for people who have those higher level psychiatric disorders. There are rare circumstances in which if the person is, say, stabilized on a mood stabilizer or an antipsychotic, that you can, it is often used in people with bipolar disorder as well to treat the depressive side of things. But you want to make sure that the mania is being stabilized before giving the ketamine, so that you don't accidentally throw somebody into a more disorganized state or manic episode.
Wow, it's listening to you talk, this it would make me want to stay further and further away from some sort of at-home administered type thing because of the just like the progressions of care that you talk about, that you kind of have the A, B, C, and then if D, then E and F situation
Yeah.
all figured out. And I feel like those are not things that you, especially if you're actually trying to, I guess someone getting an at-home ketamine treatment thing to do ketamine is one thing. Someone who's actually trying to get to a better end result or solve a trauma, I would want all the things that you talked about kind of at my disposal via a professional than trying to solve for it on the spot when it's happening. That sounds terrifying, especially given the preconceived like possibilities of what they could happen given certain other underlying elements. Like that's really interesting. With these evolutions in the progression and getting up towards those what you call the psychedelic dose, right, is 1/5 you said of the dose of an anesthetic.
Mm-hmm.
So when a patient is taking that type of dose, one, do they have to be battling a certain psychological disorder beforehand? Like, is that dose reserved really for people with depression, with bipolar disorder, or with like a specific type of trauma? Maybe that trauma doesn't lead to depression, but it's something that they haven't like dealt with yet in their life.
Mm-hmm.
Where do those doses fall on the treatment to specific issues?
Mm-hmm. So two things, I'll speak to that in just a second, but just backing up to something that you just commented on, our recommendation when people do at home sessions is they not do a dosage higher than what they've done in office with one of the therapists before. So they have a sense of how their body responds to that dosage, and they've done it a couple of times, as well as having somebody there available with them. Now, in terms of, oh geez, I distracted myself. Your question there was,
It was about the referral of the psychedelic level dose to specific pre-existing psychological disorders.
so ketamine use for mental health is considered off-label use. So in order to use a medication for off-label use, meaning that the clinical research has proven for it to be useful for anesthesia, there haven't necessarily there has been one FDA trial for Spravato, which is the intranasal spray, which doesn't come in a generic form, and it's quite expensive compared to generic ketamine, which is very, very cheap. So generic ketamine is still off-label use. There's a couple of things that need to happen in order for that to be used in the mental health setting. One is that there needs to be enough, essentially, peer evidence and support for that treatment. So there's enough people, that other psychiatrists, mental health care providers that have published or written literature reviews of various things in the community saying it can be useful for, refractory depression and suicidality and anxiety and trauma. And then you also have to prove that the patient has had other failed forms of treatment. So they've tried traditional approaches, but they haven't been sufficient in helping that patient meet their treatment goals. So that can be anything from failed forms of therapy to trying 2 or 3 different types of antidepressant medications. It really can vary, but you need to be able to document those things before, in terms of like covering yourself legally within clinical
Right.
practice if you want to administer it.
That makes sense.
So
I feel
people
like
are just curious about wanting to explore their consciousness and
right.
it's not appropriate in the clinical setting. Now, I think anybody who's showing up to a clinical setting and they're like, I have a totally perfect mental health history, you might want to like sit down and have a conversation with them and be like, okay, you might not have had like significant stressors compared to like world hunger and
Right.
emotional
But
and
okay,
physical
but
abuse in your
this is
childhood. But what else is going on here?
a really good point, because I feel like a lot of the elements in place are to disparage people from recreationally doing ketamine in a clinical setting. To be like, okay, I really want to do ketamine, but I don't want to get caught or in trouble. I know what I'll do. I'm going to go to a ketamine treatment center and, oh, my parents divorced, blah blah blah, and try and like get in there to do it in a safe environment. But that's also uh not to discredit that there are benefits, right, to its use for people.
Hmm.
So if someone, let's say, let's step out of the clinical setting for a second and say that someone, that for the same reason that people would go backpacking and take mushrooms, they want to explore their psyche, and they want to do that using ketamine. What do you say to someone like that? Is it kind of like, hey, well, it's illegal, don't do it? Or do you respect the properties within the drug as being powerful also for people that maybe not are not dealing with something extremely traumatic or a diagnosed psychological disorder?
Hmm. Yeah, so John Hopkins many years ago, I think Bob Jesse encouraged this study with psilocybin mushrooms, encouraged doing this study with healthy normals, and
Mhm.
how it's really important to show that it's not just about treating diagnosable disorders, that there can be therapeutic benefits for everybody and anybody for whom it's appropriate. I wouldn't say
Yeah.
psychedelics are appropriate for everybody, so I want to make sure that I make that clear. I think you need to have a calling, a desire for them.
Yes.
But yeah, there's so much to learn. Just like, having a healthy diet and exercising isn't just to treat diabetes and cardiovascular disease. It's
Exactly.
if you want to take care of yourself. Obviously you take good care of yourself, you're a trainer. So I think that's really important. What we can do in the clinical setting, of course, we're in a little bit of a bind. So I think in some of my bios somewhere you'll see that like I consider myself both like a clinician and an activist. And so
Right.
I'm very much in support, for instance, I think that the whole decrim movement has their various approaches and things, but as a whole, do I believe in decriminalization if it's held in the right context? I would say I am, and that not everything needs to be within just the clinical scope, and that people should be able to have access to these various modalities, even if they don't have a DSM diagnosis of major depressive disorder or PTSD. We can't necessarily take those folks in our practice, but one of the things that I do offer is, say, integration support. So if somebody's wanting to go out and experience things on their own, I can't necessarily guide them as to where or how to access, but I can, I can talk to them about set and setting. I can talk to them about when they come back and they want to talk about their experience, looking at the symbology of some of the visionary states that they had, and how some of those might be metaphors for things that apply to their life, or just what to do with the insights that maybe have arisen about their relationship dynamics with their parents and loved ones or otherwise. So I still can then hold a framework for people who are wanting to hold it for other forms of kind of transformational work, or just curiosity and consciousness exploration too.
Well, I really like what you said about the food thing. Like, you don't have to get diagnosed to have a healthy diet to, fend off diabetes, coronary artery disease. And that's so true, because if I go back to the therapy example, so I've been to therapy with a psychologist a couple times in my life for different reasons. One was more like sport related as an athlete, where I like needed to solve some things in my personal life that were distracting me as an athlete. And so that was a really profound experience in getting me like dialed back in an athletic setting. And then later in life, I had seen a therapist to talk about things about my parents' divorce that when I was 16, I just kind of like dusted under the rug. I didn't care. It was for me, it was cool at the time. I had two different houses. I could stay out later. It was easier to hang out with my friends. It was in the moment a positive experience. As I got older, uh, it became a more traumatic experience.
Mhm.
And I would find myself dwelling on it, but I didn't know why. And so I went and saw a therapist, and there were some really cool insights that I got from that that were not available to me prior to seeing that person. But from the outside, nothing was wrong, right? Like I wasn't, no relationships in my life were suffering. I wasn't uh, performing poorly at my job. I didn't have issues with my finances. There was no things on the checklist of like, are you messed up that would have checked? Yet going and doing that was extremely important. And in hindsight, it was instrumental in a shift that then happened in my life. So I think about that and I'm like, even I go back to this like the psilocybin experience thing, very positive experience. To your point, I think it's important for people to like, it's not for everyone, you know, you're like, you need to want to do it before you do it. But to do that in a clinical setting seems incredible. Like I would love to do that. I feel like the combination of professional clinical therapy and conscious altering, naturally occurring substances could be extremely beneficial to someone in any capacity. It would be that your personal life, your professional life, maybe just the way that you look or view at the world. So, how far off are we from a place where that can happen on uh, a phone call, for example, or like just me showing interest, but then also on that same question, how do you manage the risk there of it being abused and then
Mhm.
developing, you know, the issues that then develop around the abuse of it? Like, how do we begin to integrate that into our society? It's a long, a long-winded question, but
Yeah, and I think there's a lot of different parts of it that I would love to speak to. One of which is, I try to really tell people who are coming in more for integration, they're kind of more curious in the exploratory side of things, that it doesn't matter how much experience you have, how many times you've eaten mushrooms, how many ceremonies you've sat in. I personally hold the strong belief that having a therapist or a mentor or somebody that you're following up with these experiences with is absolutely essential. And if you think about more entheogenic cultures that are actively using plant medicines to work with, like, there are elders in the community. You are, talking about this amongst your peers and family all the time. And so we need to start developing things that are appropriate for more, the Western context, that provide that support. And, we've been speaking more to the clinical context, which right now the framework is more one-on-one kind of psychotherapy. But I do want to speak to the fact that I think community support is really important, which is one of the interesting things about the decrim movement. It's focused more on like, how do we have community around this, as well as thinking about, from a perspective of different demographics are going to feel safer in a one-on-one clinical setting versus a more community or group-based setting for doing this healing work.
Mhm.
And then, um, so either way, I think it's essential to have some amount of structure around it. Whereas I think a lot of the younger generation and culture can kind of be like, oh, I just kind of want to go be a psychonaut and
Right.
be more like do it yourself, DIY types. And I'm like, there's something for that framework if you really want to hold these things. And again, you'll hear me kind of combine the clinical with the more spiritual side of things. But if you hold this as like, in traditional cultures, these are sacraments. So, like, if you're holding it with this framework of staying committed to whatever practices and integration and support around it, then you're holding these medicines with a level of respect and reverence that they deserve. So that's kind of one thing that I always kind of am on a bit of a soapbox on.
Yeah, I think that's important, the respect aspect of it. And you hit the nail on the head. I mean, when you're like, you know, you're an 18-year-old kid and you're with your friends, you just want to be an idiot. The you might have positive experiences, but the idea of it in a clinical setting just really seems, it seems unique, but it also seems the safety element, that was something that I always struggled with personally. It's like it's a big risk when you do things by yourself, because you don't know where things are going to go. You have an idea of what you think, and a lot of times those are based on recommendations or advice from other people that are also not physicians, that don't know what they're talking about it when it really boils down to it. And there's a fear element associated with the risk that you know you're undertaking.
Hmm.
And having that fear present the whole time, that's an emotion that you're dealing with when you're going through this experience. And in some cases, maybe you're jockeying back and forth between the two, and it has an impact on what you're doing. I think the clinical aspect seems so inviting because of the safety that, so here's a professional with me
Hmm.
who, they know how much, they know when, they know why, and they know how. And then inside of all that is baked in this, they're also they're, my best interest is in within them, like they want to see me through this, get better, not just uh laugh about it with me later, kind of thing. And that, I think, seems really, really special about it. It would be so what do you do at Sage if you have people that have interest in doing something like that, but they don't hold any of those diagnoses beforehand?
Hmm. One of the options is that if it feels like, again, because I feel like all of us have something, whether or not are consciously aware of it or not. A lot of times what we'll tell people is, right now you don't qualify for treatment, but you could start an individual therapy and see what emerges from there. And then if at some point in time it feels appropriate, we might be able to transition you into the ketamine work as well. So it is, I don't want to say it's totally ruled out. There are circumstances in which we can make exceptions for folks, but we kind of have to monitor them within the therapeutic process, to be able to support it clinically for them.
That makes sense. It always blows my mind. I return to this thought so much, how destructive alcohol is just
Mhm.
across the spectrum, and how frequently destructive it is. And I've witnessed its destruction firsthand in my life, all over the place,
Yeah.
personally. And then if you expand that out to your community of acquaintances, or people that I mean, show me something more destructive, please, and I will be surprised. And yet it is just, you go sit on the beach in Santa Monica and there's banners tied to airplanes telling you to go party in Mexico and get drunk. Like, imagine a world where you're sitting on the beach in Venice and an airplane flies by and it's like, hey, have a therapeutically positive experience with a clinical
Yeah.
professional. I'm like, we got that so backwards somehow as a society, and now there's so much money behind the alcohol industry. But I don't know, that thought always pops in my head. I find it so funny that one is so reserved and closed off, yet like empirically beneficial, and
Yeah.
then one is, hey, have it whenever you want. It's like the biggest destructive thing in our society. It's crazy.
I just recently was with my parents, and I like to remind my mom, because alcohol is so socially acceptable, but I can promise you that nobody's really going to get on a bar fight if they took a bunch of mushrooms
Oh no.
than if they pounded a bunch of beers.
I know, it's like, what happens? You like want to spend more time outside. Uh, you treat people better. It's
Yeah.
like the list goes on and on. I want to be respectful of your time, but I would love to get your insight too on, and I feel like we're going to have to do another episode in the future because there's so much I want to talk about that we didn't get to. But
I could talk
with,
forever on this
yeah,
topic. So.
I love it. With the popularity of ayahuasca, and I can only again speak to like my experience here, but if the last 15 years, I would say I've heard about it more and more and more and more. And it transcends age groups. From there's people quite younger than me that I hear talk about it. People around my parents' age, I hear it in conversation. I know people personally that have gone on experiences, or they've traveled to Peru, they've done it domestically. Um, why do you think that that's grown in popularity? We'll just start there, and that way I won't cloud the questions. But um, what do you think led to the growth of ayahuasca as like a something that people are willing to venture to go do?
Mhm. Yeah, I think there's a couple of things there. I think if you take more of like a systems and ecological approach to the world, I think people are feeling a lot more awareness, or it's in their awareness much more the ways in which things are out of balance and our relationship to nature is out of balance, and how that impacts their sense of well-being and how they're interacting with the world socially as well as environmentally. And so I think people are becoming increasingly more curious around spiritual experiences that bring them into more contact with that, so that they can have a bigger benefit within themselves and within their community and more broadly. And another piece being is that our culture is becoming so increasingly more isolated, and
Mhm.
most of the ayahuasca work is done within a group context. And
Yeah.
people are really, really starving for more communal experiences and more shared spiritual experiences, I think, within a community context, as well as people are kind of less interested in maybe more structured religion. They are still aware of how, there have been plenty of studies out there, which I really appreciate, showing how having a spiritual connection of some sort improves your overall health and well-being.
Mhm.
And so, I think it spans the age range, the generations, because I think the young folks are really aware of it, and then as people get older, they're, in their end of life stages are approaching, they become more aware of the ways in which they want to be plugging in so that there can be that deeper sense of hope and connection.
Right.
um yeah,
And then within that,
yeah.
how do you advise people to make mindful choices around the use of ayahuasca?
Yeah, so this one's so tricky. I think it's really important to make sure that you are going to a reputable person or a retreat center. So either somebody has been there before and you can talk to them directly, or they have good recommendations. Making sure that there's the appropriate support structures. So if you're traveling abroad, what's the safety? What's the transportation like?
Mhm.
What sort of support do they have outside of just the curanderos that are holding the experience? But are there other folks that can kind of help bridge, especially for Westerners, the cosmological framework that maybe a traditional ayahuasca healer is holding, in helping bridge to like the Western context, to how you contextualize that experience, um, as well as safety in this setting. I think taking care of the local community, like there's lots of ayahuasca retreat centers that are popping up, but are they actually doing a good job of making sure that they're not just kind of appropriating the traditions, but they're actually doing a good job of making sure that the traditions are being carried forward in a thoughtful way, as well as offering employment opportunities and some sort of reciprocity to the local communities that they're working in a good way. And a lot of different, as well as thinking about ecological aspects of, how are they um, harvesting the vine and the chacruna to make the actual ayahuasca brews. So I think there's a lot of different levels of what you want to be thinking about that. And if people are doing things more domestically, there's a lot of it's like drive through shamanism, and where like
That's about what
shamanism.
I'm getting at. Yeah.
Yeah. And so, I get it that there's healers that are coming from abroad, and I do think that there's an importance in kind of their delegating tasks. Like there's certain things that the healer can really show up for and they're there for in the ceremony, but then who's part of the team, so that if people are needing support, Are they doing group integration the next day? Are people available to do individual or group sessions following the work so that people can continue to get the support? Or are people just kind of coming through doing the ceremony and then people are just left to their own devices? Like, that's not a supportive enough structure.
Right. Yeah, I have been exposed to like a lot of that just because unfortunately I spend quite a bit of time on social media trying to, market these podcasts and episodes and stuff like that. And it feels, I don't know how to describe it, but it just seems like if I'm thinking about a conscious shift, like if I'm after shifting my conscious understanding of the world, and I want that to be a spiritual experience and a meaningful experience, and hopefully a lasting experience with positive outcomes. Getting that experience from another person who's like glued to their phone, telling you about how enriched their being is, it just seems off.
Yeah.
Like it's missing the mark, and that therein lies the proof that that's not actually the level that that person lives on.
Mm-hmm.
And so I wonder about again, just like the risks associated with that kind of thing, because this is not playground stuff, it's life altering potentially. And to place that in the hands of someone who claims to be a professional in the area but isn't, I can't imagine a bigger risk on like your psyche than that.
Yeah, I think that's huge. And I think one of the things to differentiate between maybe ayahuasca and other psychedelics is that I really firmly hold the belief that, like, you want to go to a practitioner who has been sufficiently trained. And that's not just like, hey, I did one of the psychedelic assisted therapy programs for a year or two. Like, people who are really holding the ayahuasca tradition and holding it well, they've apprenticed for a minimum of 10
Right.
years before they're even serving ayahuasca. And so really holding that, like, those are the types of people that you're wanting to sit with, and not just somebody who's familiar with it and decided that they can just sing really beautifully and start playing ayahuasca. Like, there's so much of that, especially in California.
Yeah.
And again, also, like, when you see people posting things like crazy on social media, for me it's like, same thing as like when somebody's advertising themselves as like, I'm a psychedelic assisted therapy therapist. It's like, my question that comes back to them is often like, and this kind of ties back to one of the things that I feel grateful for that experience from 10 years ago, which is like, it taught me a tremendous amount, like, of humbleness and humility.
Mm-hmm.
And so when people are advertising themselves, there's again a certain level of respect and reverence that you want to see that people have in deep relationship to these medicines before they're offering it to other people.
Right.
And when you see people advertising in that level, my question is like, what is your relationship to that medicine? Like, do you actually have that deeply respectful relationship? Because otherwise I don't think the plants necessarily want to be out there advertising. That's not really this sort of vibe that they give off.
Yes.
So
I'm so glad we're on the same page. I mean, it breaks my heart when we get to the end of the hour and a half, because it goes by so fast, and there's still, like I said, so much I want to talk to you about. I'm about to read this book called The Immortality Key,
mm-hmm.
and I'm sure I'm going to have a trillion questions. So I would love to do another episode where maybe we can dive even a little bit deeper into some of this stuff.
It's been on my reading list, so maybe it'll be a good motivation for me to read it too.
Book club. Yes.
Book club. Yes.
Excellent.
Even Julie
Awesome.
Book Club. I'm into
Yes.
it.
Everyone is welcome to join. Awesome. Well, there will be in the show notes everything about Sage, how people can find you, your practice, to reach out to you personally. And then we 100% will do this again in the future. And thank you so much for your time, Julie.
Yeah, totally. This has been really sweet and lovely. I hope you have a beautiful rest of your day.